Primary care clinicians can successfully manage many adults with ADHD. But knowing when to refer is just as important as knowing how to diagnose and treat. Some patients present with straightforward symptoms and respond well to treatment. Others have more complex presentations that require additional psychiatric, behavioral health, or medical support. One of the clearest reasons to refer is diagnostic uncertainty. If the clinical picture feels incomplete, inconsistent, or atypical, additional psychiatric evaluation may be necessary. Adult ADHD shares symptoms with many other conditions, including anxiety disorders, depression, bipolar disorder, sleep disorders, and substance use disorders. When the history does not clearly support lifelong ADHD symptoms beginning in childhood, it is important to slow down and reassess before moving forward with treatment. Referral is especially important when bipolar disorder is suspected. ADHD symptoms are generally chronic and persistent over time. Bipolar symptoms are typically episodic and fluctuate between periods of mood elevation and depression. This distinction matters because stimulant medications may worsen mood instability or trigger mania in untreated bipolar disorder. If bipolar disorder is suspected, mood stabilization should occur before considering stimulant treatment. Referral may also be appropriate when patients fail to improve after trials of 2 stimulant medications. Persistent symptoms can reflect incorrect diagnosis, untreated comorbid conditions, medication adherence problems, or more complex psychiatric illness. At that point, psychiatric consultation may help clarify the diagnosis and guide next treatment steps. Active substance use disorder is another important reason to consider referral. These patients often require coordinated management involving behavioral health, addiction treatment, and careful medication monitoring. When stimulants are prescribed in higher-risk patients, clinicians should consider extended-release formulations, medications with lower misuse potential, and structured follow-up. Some patients may also require cardiology evaluation before or during stimulant treatment. This includes patients with structural heart disease, significant arrhythmias, uncontrolled hypertension, syncope, chest pain, or family history of sudden cardiac death. In these situations, collaboration with cardiology improves safety and reduces risk. One of the most common mistakes in ADHD care is diagnosing solely from patient self-report. Whenever possible, obtain collateral history and verify childhood symptoms through family members, school records, or previous documentation. Another common pitfall is inadequate follow-up after starting medication. Without structured monitoring, clinicians may miss side effects, misuse, undertreatment, or worsening psychiatric symptoms. It is also important not to overlook comorbid conditions such as anxiety, depression, sleep disorders, and substance use, which frequently coexist with ADHD. Most uncomplicated adult ADHD cases can be managed effectively in primary care. The key is recognizing complexity early, monitoring carefully, and referring when diagnostic confidence or safety becomes uncertain. Thoughtful collaboration between primary care, psychiatry, behavioral health, and cardiology leads to safer and more effective care for adults with ADHD. In the next module, we will apply these principles through case-based clinical decision-making.